COVID has never really gone away here. The Royal Bournemouth Hospital is still treating patients, finding beds for those critically ill with the virus.
What do you remember of the last couple of weeks?
Gary is well enough to leave intensive care and be treated on a ward elsewhere.
Is there a bed in the ward?
Not at the moment, unfortunately. Every day we look at the number of beds we have in the hospital. So at the moment he's going to stay with us. Okay, and we'll get him out as soon as we can.
Michelle knows, though, that once Gary does leave, another COVID patient like him will likely take his place.
May I ask if you were vaccinated? No. Do you perhaps regret that now, that decision? The problem is, for every COVID patient that ends up here, there are other people who need planned operations that then can't have a bed here. That is why so many of those have been cancelled or postponed. They're waiting here to get onto a ward. 16 hours they've been waiting.
Yeah.
Demand in A&E is even greater. Huge numbers of patients are turning up here, then waiting for hours to get onto a ward.
A lot of patients are kind of voting with their feet because there's such long waits for ambulances, so they're walking in with illnesses that they would have otherwise presented via ambulance. We describe it with a bit of a medical Where's Wally, where we're trying to find the sickest patient in a crowded waiting room, because those chest pains and abdominal pains are also being mixed with patients that should really have gone to the GP.
Bruce says they'd never turn anyone away, but once patients are in, it's becoming harder to discharge them.
We've got 7 wards worth of people that shouldn't be in hospital at this very moment.
7 wards worth?
7 wards.
That's 200 people fit to leave but can't because so many care homes are shut.
If you could get those people out, what sort of impact would that have here?
Automatically, if you've got flow in our wards, if you've got empty beds in our wards, that means we can empty our emergency departments, which means we don't have any queuing ambulances, which means those ambulances can go to give care at home.
Or in a shopping centre. The hospital's resorted to turning this department store into a diagnostic clinic where twice as many patients can be seen.
We have to do something. The alternative is just to carry on as we've always carried on. Let the waiting list grow, let patients lose their sight or their health deteriorate.
Doing nothing is not an option for this hospital. Patient care has to continue no matter what. Emily Morgan, ITV News in Bournemouth.